Welcome, friends. Revise with me homeopathic materia medica. And this revision is from Ellen's keynote, which is in a series. Here we are dealing with remedy number 24, Arnica montana. This is one of the very important polycrest remedy which comes in play into the day-to-day practice. So we are just going to the text. Let us see. This is the text which we have picked up from Ellen's keynote. The text is given in small sentences, and this is a brief general information about the clinical application of this important remedy. And as we can see, the common name is leopard's bane. It belongs to vegetable kingdom and its family is compositae. Please remember this remedy was proved by Dr. Hahnemann. If you go sentence by sentence, we have picked today's special point in this remedy, which is highlighted in the red alphabets. Tendency to small painful boils, one after another, extremely sore. Small boils in crops, you have the very important remedy sulfur. Sulfur is a first remedy which belongs to antisoric group, king of antisoric, and skin eruptions and a small pustule formation. All acute diseases belong to Sura in its purest form. If you like to see the clinical picture, you will be able to recall, remind, and refresh your memory about how the folliculitis looks in the clinical practice. Same time, we will see the pathological diagrams which gives the things which we cannot see in the superficial examination of the skin. The first part is the skin, the layers of the skin, the epidermis and dermis, and the hair follicle is present in the dermis. You can see the hair root, and you can also see the sebum secreting gland which is associated with this hair follicle. Now, in the hair follicles, if the infection trickles down, because in our skin surface lots of bacteria they colonize. There are good bacteria, there are bad bacteria, but mostly those bacteria they are very great help to our health and maintenance of healthy state of our skin, because they will not allow any other bacteria to settle down there. It is their colony. If the infection trickles down into the hair follicle, there will be small pus formation, and that will be the common condition known as furunculosis or folliculosis. So let us try to clinically correlate this particular thing. The furuncles, they appear on the hair bearing part of the skin. That is the foremost important thing which I would like to remind you, that the part where the skin is full of hairs, that is the most important area where you will have. And then infection which is commonly occurring over there is the Staphylococcus aureus. This particular bacteria is a cause of this problem. The furuncles, which are deep infection of the hair follicle, they are going to form abscess. So formation of abscess is a large correction of pus and necrotic tissue. Then these boils or furuncular abscesses may occur anywhere on the body, although their predilection is on the hair bearing area. But second important thing is they are mostly present in frictional areas also. like where armpit is situated, buttocks are present, face, neck, and thighs. How these infections are facilitated? They are facilitated by your weak immune system, which increases your susceptibility. So, what are the key indications for arnica we have? We have small, painful boils, one after another, and they are extremely sore. This is the key indication. Second important point which we need to remember is effects of mechanical injuries, bruises, sprains, and contusions. They can also cause breach in the skin and facilitate the bacteria to trickle down and to cause infection. Next important thing which occurs is once the infection is there, you will have the pain, soreness, lameness, bruised feelings as if bitten, numbness, and underlying muscle will become stiff. It is a reflex phenomena, muscular stiffness. After strain or overexertion, you find your immune system goes down and you become prone to infection, as well as your susceptibility to bear the pain also goes down. So small pain which you could bear easily becomes big pain and you become nervous if you are extremely exhausted. And then important point in terms of arnica is everything on which you lie, it seems too hard. And this is a very constant complaint which a arnica montana patient is going to come with. So if you give the arnica, what benefits we anticipate from this? We feel arnica helps in prevention in terms of suppuration and further course of disease which goes into the complication like septic condition. It helps to abort it if timely prescribed. It promotes absorption of lacerated tissues and those necrotic part, and it heals the local tissue. It helps to relieve the soreness, stiffness, and bruised feeling, especially which occurs after injuries. And further most important part is it is also useful not only for ankylosing but also in carbuncles and deep abscesses. But if you have something primary fundamental cause which acts as a disease maintaining cause here, like psychotic miasm, I mean to say the diseases which are psychotic in nature, like obesity, like diabetes, if they are present, your medicine is going to help, but will not be able to entirely eradicate the disease because the foundation is somewhere else. It is not a psoric case. So, friends, let us go to the next slide. But then, before that, we can remember once again that the Arnica montana is a key remedy for painful boils, effects of injury, even stupor and extreme soreness is covered by it. Stupor here is because of toxic state. Now, we are going to have some general information from the biomedical science, the current medical considerations which we would like to see because whenever we diagnose a condition, we have to make a reporting and maintain its record. So we maintain it by ICD 11. So in ICD 11 perspective, we are going to revise this particular condition. So broad definition of this furunculosis is it is a recurrent boil which are painful, which are pus filled, and they are present at the hair follicles and they can recur at the same time in the same area or some other area in the body. Let us go to the cause, and the cause is bacterial infection. And most common bacteria which is going to affect is Staphylococcus aureus. The precipitating cause is poor personal hygiene. It can be because of excessive sweating. You are working in a furnace, you are working in open field area where sun is very bright. An underlying fundamental cause, not only sora, secondary miasm if you have, and that causes diabetes and obesity which go by hand in hand. They act as immune suppressive phenomena and they will attract these kind of infections, so that needs to be kept in back of your mind. Then immediate exciting cause which precipitates the infection or helps the infection to trickle down is friction, tight clothing, nutritional deficiencies, especially proteins, minerals, vitamins, and then the mental state which we always keep foremost is a chronic stress and fatigue, which is weak, make your system weak and facilitate the entry of infection in the system with ease. Now let us go to the clinical features. What are the clinical features? What we examine? The painful red swollen nodules are there on the skin. We have these lesions have been pus filled areas. They are hot, throbbing pain, recurrence in the same area or different areas. And once they heal, they may leave the scar. If the infection is serious and severe, you may find accompanying fever, malaise in severe cases. If things go beyond that, it will cause complications. So furunculosis may lead to carbuncles, abscess formation and cellulitis. This is a more serious kind of a thing. So what is the key takeaway we find here? Arnica montana is definitely a very good remedy for painful recurrent boils with pus formation, especially when it is caused by bacterial infection and precipitated by friction or poor hygiene. That is the gist of it, what we have learned by now. Friends, we'll again explore few more things. So, triggering causes for this infection is low resistance, trauma, friction, poor hygiene, stress, fatigue, and nutritional deficiency. Sometimes we need to investigate if the patient is not responding. So, investigative part is complete blood count will give you a good idea about how serious the infection is and how chronic the infection is. You can also go for blood sugar examination to screen for status of blood sugar. If you are not convinced the patient is having diabetes and not following instructions, you can go for the 3 months record, ABA1C, and then if still the infection is not responding, you can go to the swab culture sensitivity test. There's something to do with the allopathic medication to keep in mind and select the proper antibiotic. If there is a HIV suspected, go for screening and you will have your answers in terms of why the patient is not responding. It is not your medicine is incorrect. It is not that you have neglected the hygienic part, you have not neglected the food part, you have not neglected the obesity and other things which you are looking after, but still the patient is not responding. go for something more than that. Next important thing, complications, always keep in mind cellulitis, abscess formation, carbuncle, and there can be septicemia, which is rare but it is a serious complication, and scarring is important. So looking at these particular complications, please remember they are associated with high fever, rapid spread of infection, there can be severe pain and swelling. Don't miss the boils which are present around eyes, mouth, nose, spine, face and genitals. They need potent kind of a treatment planning, immediate control. Immune compromised patients are also there. They need also to be controlled with antibiotic manner of treatment. They need to be referred to the proper facility. You can continue your homeopathic medicine, but it is secondary now. The primary is life saving and controlling of it. You need to have the counseling inside. Always stress upon maintaining the hygiene and skin cleanliness. Avoid scratching the skin. Keep the nails short. Do not squeeze the furuncle. Always wear the loose clothes and maintenance of your immunity at the optimum level. Then comes the treatment part. In treatment part, you will come across there are three levels of interventions. We have health promotive intervention, early identification and treatment, and tertiary prevention is when there are complications, aggressive management protocol. So the very first thing is the primary prevention because homeopathic doctors are practicing in the primary healthcare management system. You are present at the doorsteps of the patient. So you are the first contact. You have to teach them the health promotion things, and those are good personal health care, the importance of balanced diet, especially the protein, vitamins, and minerals, about their clothing, avoid tight clothes, avoid synthetic clothes, always wear cotton clothes, avoid friction. If you are diabetic, please control your diabetes. If you are having stressful life situation, stress management is very, very important. The immediate goal of this kind of a counseling and patient education is to prevent the disease, and if the disease is there, prevent the recurrence. That is the fundamental thing which we have to keep in mind. Next is the secondary prevention. Here, important thing is diagnose as early as possible, and if you have the diagnosis, you can start prompt treatment also. If the patient comes to you with antibiotic, he is taking antibiotics, allow him to take the complete course of antibiotics. Do not stop the antibiotics in between because that particular flora, bacteria which lives on your skin will become resistant to it and then it will become a big problem. Regular follow up is very, very important, and side by side maintenance of personal hygiene, skin hygiene is very important. So this also helps treating the condition and preventing the recurrence and preventing the complications. If at all there are complications like we have abscesses, cellulitis and sepsis, this condition requires a hospitalization and allopathic or antipathic management, which is very important. So you need to send the person to appropriate facility so he can manage the problems at the war footing. They will take care of nutritional support, immune strengthening, and our goal is restoration of health and putting back the quality of life. Disease limitation also is one important thing. disability limitation if the problem is severe and there are other complications. Now, please remember once again what are the red flags. We have high fever is a red flag. We have rapidly spreading infection is a red flag. Boils around the eyes, face, nose, they are small, but their nuisance value is so big that they can create a cavernous sinus thrombosis. So be careful about it while treating. They should not be squeezed. If the infection is around near to the vertebral column, please be careful about it. If there is severe pain and swelling is there, that also needs to be relieved. Pain relief is very, very important. Don't allow your patient to suffer, keep on suffering under pain. Please look after immune compromised people, whether they are because of some diseases like diabetes mellitus or HIV, or they are because of some medication like chemotherapeutic agents if the patient is taking. Be conscious about it. Sometimes there are patients who have some problem, maybe bronchial asthma, they are on a steroid. There are like diseases like sarcoidosis, patient are getting steroids. So please always be specific about getting the list of the medicines what they are taking at the same time, because patient may come with the fungus infection or boil, but the root cause is something secondary. So explore it. Multiple large boils will require tertiary healthcare management system. Maybe they require drainage. So friends, that is where we are now. So most important message is share and care. The highest art of cure is not to help the nature. It is also important not to do the harm with your medication or prolonged treatment which is not required at that particular time. So please share your knowledge, promote the wellness to your target people whom you are serving with care and compassion. Inspire and motivate your patient and your colleagues. Support and guide who require your help. Together we heal. Together we can build a healthier, happier community. That is our goal. So friends, thank you very much once again. You have listened me so far very patiently. We'll meet again with some other new topic tomorrow. Thank you very much